Good afternoon. My name is Roxanne Hickman, and I'm an epidemiologist for the Louisiana Department of Health, and I would like to thank the Louisiana Bureau of Health for allowing me to present today on the very important topic of infant mortality that is affecting the mothers and children in Louisiana. Infant mortality in Louisiana has a rate of 8.9 out of 1,000 live births. The national average is 5.9. While the infant is most affected, the health is a direct result of the health of their mother. The parents of these infants live in a state where 20% of the population live in poverty and 56% of the female population work in labor force. Louisiana is rated 11th for the highest rates of uninsured, but the residents now have Medicaid expansion. There are many factors that can contribute to infant mortality. Some of those factors include healthcare accessibility, and the parent's smoking status. Infant mortality can be caused by maternal complication, sudden infant death syndrome, birth defects, low birth weight, premature birth, and respiratory distress syndrome. As an epidemiologist, my role is to collect data on infant mortality in Louisiana to help pinpoint major factors in this health issue that can be resolved. Each factor will have to be dissected to determine its role on infant mortality or a corresponding health issue that leads to death. To determine the best interventions that can be created, data will be collected on the mother's health and the behavior before and during pregnancy. I will look at smoking status, diet, vitamins, and infections that are transmitted to the child in utero. The social ecological model is used to understand the different levels of the social system and how they interact together to identify different behaviors in an environment. For this particular issue, I would like to describe how each level helps and hinders the infant mortality rate in Louisiana. For the individual level, the health of an infant and their mother benefit from the knowledge gained from education or from personal experience that helps one make the healthy choice before, during, and after pregnancy. This knowledge also hinders health by creating a resistance to full-term birth based on the culture in Louisiana. The interpersonal level looks at family, peers, social networks, and providers. One organization called Louisiana Birthing Outcomes Initiative encouraged providers to stop elective preterm births. Peers and family may encourage engaging in activities that involve drugs, alcohol, and smoking, and can cause a fetus to suffer birth defects. Some of those birth defects can lead to death. For the organizational level, community-based organizations can help prevent infant mortality by providing the parents with education, health care, and financial and mental assistance. A hinder for this level is that uninsured and underinsured women have less prenatal visits which affect the child in utero. Also, uninsured newborns may not go to a primary provider, thus missing important health issues. On the community level, the infant mortality issue can be helped by working with local health department partners, healthcare providers, and government assistance programs to reduce the mortality rate. Unfortunately, in a low socioeconomic community, may hinder healthcare access, resulting in fewer prenatal and infant provider visits. Lastly, at the policy level, many programs have been created to help protect mothers and infants, such as Title V, Healthy Start, and the National Maternal Health Initiative. There are policies in the U.S. that hinder maternal health, such as restrictive access to contraception. Families are not ready to have children, may not have the education and healthcare access to have a healthy pregnancy, deliver full term, and create a safe environment for the infant. These proposed interventions are for the health of the mother and the baby. For the first intervention, supplements such as folic acid, calcium, and zinc, and protein will be added to the mother's diet to reduce infant mortality. Folic acid reduces neural tube defects, calcium reduces hypertension in mothers, protein increases birth weight, and zinc reduces preterm birth risk. Mothers in Louisiana will be educated on eating healthy during pregnancy and will be provided with free supplements during their prenatal visits. The second intervention tackles smoking. Smoking tobacco during pregnancy causes low birth weight and preterm birth. Mothers and their family members will be educated on the harmful effects of smoking, and uninsured mothers will be eligible for stop smoking programs and free nicotine patches. The nutritional and smoking interventions will fall in the community and organizational level of the socio-ecological model. The last intervention focuses on infections that the mother can pass to the child in utero. So, in addition to testing during the first trimester, testing for HIV and syphilis will occur during the third trimester to ensure there has not been any transmission before delivery. This last intervention will require a policy change on the state level to ensure providers perform the test. The goal of the first intervention is to target expectant mothers in the highest infant mortality region in Louisiana and provide them with the CDC's recommended amount of folic acid and reduce infant mortality to 6 per 1,000 live births by 2025. We will know the intervention is successful when the mortality rate drops to 6. The current infant mortality rate is 8.9 and the national average is 5.9. Infant mortality data will be collected from local and state surveillance programs. One important aspect to assure a successful evaluation is a long timeline. Issues like mortality rate do not drop overnight, and it takes years of funding, planning, and evaluation before a program can even begin. Once a program begins, it may take a couple years to start to see results. The goal of the second intervention is to reduce the amount of mothers who smoke during their pregnancy to 5% by 2025. 16.6% of women admitted to smoking during their last trimester, and the intervention will be successful when women are educated on the dangers of smoking and are willing to quit while pregnant and after birth. Data is currently collected by the Louisiana Pregnancy Risk Assessment Monitoring System, and this will be collected after the intervention has completed. For a successful evaluation, a large amount of the intervention will need to be placed on education. Another aspect of this evaluation will be funding for advertisements. I believe that in order to reach a large amount of the population, billboards, radio, and TV ads will need to be taken out to educate as many people as possible. The goal of the third trimester is to create a policy by 2025 that requires healthcare providers to test pregnant women in their third trimester, allowing for enough time to provide them with adequate treatment. The intervention is successful if the number of HIV-positive infants is below 1% and the number of congenital syphilis cases is below 10. Congenital syphilis has increased dramatically in the last few years, from 18 cases in 2011 to 54 cases in 2015. This infection can lead to a stillborn, and it is completely preventable. Congenital syphilis data will be collected from local and state surveillance programs. Even with a policy in place, the physicians and healthcare providers will need to be educated on the policy and what it entails. They will need to be educated on the importance of third trimester testing and how it affects infant mortality. One of the major challenges for the nutrition and smoking interventions is funding. Funding will be needed to support staffing, lease a location to house the interventions, and be able to provide free health care to the mothers. Funding will also be needed to purchase large amounts of folic acid and nicotine patches to provide to the mothers. Education will be a challenge because the staff that will work for the nutrition and smoking interventions will need to be able to find the mothers who are in need of the interventions, and then be able to educate them in a way that changes their behavior. Behavior change will be the best way to ensure the mothers have learned enough to have a healthy pregnancy in the future. Adherence means making a commitment to stick to the program and continuing to take folic acid or use nicotine patches for the duration of the intervention. While mothers may want to be adherent to the intervention, other factors such as lack of transportation or lack of childcare may create a challenge for them to follow through. Lastly, collaboration with organizations may be a challenge for the third trimester testing policy intervention. Healthcare professionals from different organizations and backgrounds will have to work together to create a policy draft strong enough for state legislators to vote for. Also, once the policy is in place, there will need to be a collaboration, let's say between the local health department and healthcare providers, to put that policy in effect. This is a logic model displaying the proposed inputs, outputs, outcomes, and the impact of the 3 interventions. This is a visual representation to show the timeline of what we expect to happen once the interventions are in place. So thank you so much for attending this meeting and hearing our proposal for these interventions. I look forward to working with you in the future.